stopping asthma attacks. A new device connects with your smartphone. The app lets you know when medication is needed before you experience symptoms. It also helps you track your personal triggers so that you can be on alert or possibly avoid them in the future. The founders of the St. Louis-based startup company first created the technology as part of a Washington University school project.
So we started with Wing really back when we were at WashU. So Abby, my co-founder, and I were both students studying engineering. I was in mechanical engineering, she was in biomedical engineering. And we were both part of this group called Engineers Without Borders that allowed students to work on solving real-world problems. So Abby and I got started and we saw this big need for respiratory diseases. And I think the more that we started to learn about it, we saw these ridiculous statistics. 1 in 10 people has asthma. You just don't think about it, but in a big room of people, you have a big chunk of them who have asthma and you don't necessarily talk about it. So it's very kind of under the radar. It's a really big problem that hasn't really seen a lot of innovation. We built Wing, and Wing is a pocket-sized sensor, and it connects right to your smartphone through the headphone jack. Because all of us have these powerful computers right in our pockets, it allows you to really harness that. So for us, it made the hardware design very simple, very elegant, where it actually is using all the power and the processing power and the storage and the interface of the phone. So what Wing does is it allows you to measure how your lungs are functioning. So it plugs in right through the headphone jack. You breathe in as much air as you can, and then you blow as fast as you can through the device. And it's able to actually use sound and acoustics through the headphone jack, where it tells you how your lungs are doing. This is a way for them to understand how their asthma is doing before they even feel that an asthma attack might be coming on. So to help them identify or detect an exacerbation early and actually take action so they don't need to go to the hospital, they don't need to go to the ER. It's really about how do you move asthma from something that's more reactive to something that can be a little bit more proactive. And to start out, we'll try to measure our lung function. And the way we have it set up, it's like a space exploration themed game built into the experience. We're going to fuel up our fuel tank. And what it's doing, it's actually measuring how fast I can get the air through the device. So now our rocket is ready to go, and we're going to blast off to that mysterious planet. Wing can help you detect something that you wouldn't see yourself. So by the time you actually feel your lungs are constricting, you might be down to 50% of your lung function. But if you could know at 80%, hey, things aren't doing well, even if you're feeling fine, for a lot of people, it's really hard for them to sense those small changes because it happens over time. And you might feel, a big drop, but by then it's already too late. So it's helping to kind of step in early and mitigate that to get back on track. Wing is something that helps keep you flying, helps keep you going. So you kind of take flight from something like asthma, which is historically a very kind of negative connotation about air, to try to kind of recapture that idea into something much more positive. Right now it's about $130 for the device, and that comes with the hardware sensor as well as the app included. One of the things that you can also do is log a trigger. So let's say that you encountered a dog or a cat and you wanted to mark that because you thought it might have affected your lung function or your asthma. Allergies and asthma are really two sides of the same coin. A lot of people, though, it can be seasonal. The winter maybe is a problem. Is it the cold air that's really doing it when it gets colder? Or is it maybe something that's more internal? Maybe it's that, their radiators kick in and maybe that dust is really the problem. So there's a lot of interesting things to learn, and when you can track your lung function on a daily basis, then you can really start to correlate those different factors. And one of the things down the road is because we can capture your GPS location when you're doing the test, to then pull in that weather data to help you understand, externally, pollen or other weather conditions, how that might be affecting you, and help people identify for them, what really might be causing it. The main goal initially of our company was to get through that FDA clearance process, but that allows us to then in the US actually sell it over the counter. And the next steps are kind of, improvements, new features, and kind of the evolution of where we see it going next. But for now, it's really focusing on kind of spreading the word about what we're doing.